is open and breathing normal. And let me just check real quick. Okay, looking at your face, not seeing any signs of cyanosis. So our circulation looks just fine. So that's the very first thing we needed. Now, if you wouldn't mind just confirming your name and date of birth. Good. Excellent. And do you have any other name you like to go by? Nickname or anything? Okay. Alright, so we are oriented to person. Would you mind telling me, to the best of your ability, what time it is? Okay. What about the date? That's a little bit better. It's hard to tell time in here, I know. Okay, and where are we right now? Okay, and what are you here for? That's right, we're here for a head to toe assessment. Wonderful. So, now that we've got the important information out of the way, my name is Calliope. I'm going to be administering your assessment today. It's very nice to meet you. Now, do you have any particular areas where you are in pain currently? Okay, tell me a little bit about that. Okay, and what does that feel like? Okay, does it stay in the same place, or can you feel it radiating to other parts of your body? Okay, so regional. And on a scale from 1 to 10, with 1 being no pain whatsoever, 10 being the worst pain you've ever experienced, how would you rate this? Okay, so more annoying than anything. Okay, and when did this begin? Okay, and it's been going on the whole time. It hasn't started and stopped. Okay, well, let's do a bit more investigating. So I'd like to grab your vital signs real quick. So we're going to start by bringing out the sphygmomanometer here. I'm going to uncover your arm. There we go. And we're going to put this on the upper arm. I'm just going to make sure that those tubes run along the radial artery here. Okay. Let me get my dial clipped in. Make sure that's all closed. Okay. I'm going to put the diaphragm of my stethoscope in the crook of your elbow here. And with the other hand, I'm going to pump the little bulb here. It's going to get quite firm. Okay, almost there. And, alright, stop. Just a little bit. Okay. 110 systolic. 80 for diastole here. Yeah. There we go. So that's a great blood pressure. I'm not worried about that at all. Let's just get you unhooked here. And I'll let you come right here, but I am going to take your pulse here. So I'm just going to start. Times 4. Okay. 110 over 80 millimeters of mercury. And we have 12 respirations per minute. I have one of these fancy temporal thermometers here. So I'm going to turn off the beeps here. And then I'm just going to put this right here and skirt it across your temple. Okay. That is 98.4 degrees Fahrenheit. Okay. Now, we are going to start at your head and work our way down your body, checking different systems, circulatory system, integumentary, this, that, and the other. So, let's just start by looking at your face for symmetry. So we don't have any areas of drooping. We don't have any areas of swelling. Everything looks normal. So I want to check your cranial nerve number 7. This governs your ability to make facial expressions. So if I could have you raise your eyebrows, close your eyes real tight. Good. Smile real big. And puff out your cheeks. Okay, good. Cranial nerve 7 is intact. Good. Yeah. I'm going to do a little palpation around your face here. Just to make sure everything is normal. Do you feel any tenderness at all here? Okay, good. On the head. No. Okay. So we are going to check another cranial nerve, and this is going to be the accessory nerve. It's very easy to test this one. I just need you to shrug a few times. Good. Okay. And now I'm going to test some head range of movement. So if I could have you bring your head all the way up and all the way down and to the side, tilt your head to one side and the other. Okay. Any pain or restriction in movement with any of that? Okay, excellent. So let's go ahead and check your lymph nodes real quick. So I'm going to come here at the back, the head, and then to the ears, behind the ears, in front of the ears, under the jaw, down the neck, and along the clavicle. Okay, excellent. Now I'm going to get a little up close and personal. I want to assess the trachea and make sure it's not deviated to one side or the other, that it's just straight. And I'm also going to be assessing the thyroid as well. So this might be a bit uncomfortable. Making sure it's midline. Okay. And as for the thyroid here, I'm going to have you take a dry swallow, like so. Okay, excellent. Cranial nerve 11 is intact. That's our accessory nerve. Normal range of movement. Lymph nodes were all non-distended and non-tender. Trachea midline. And thyroid was normal upon palpation as well. There we go. So, let's take a little peek at your eyes, shall we? Okay, I'm going to grab my light. And I'm going to get a little closer. I just want to look at the sclerae. I want to make sure the eyes are in alignment. Good. I want to look at the eyelashes, the lacrimal glands, the irises, pupils. Okay. pupils. Okay, and can you look right here? Good. Good. Okay. Can you look at the wall once more? Excellent. And look right here. Good. Yep. Good. Okay. So, equal, round, reactive to the light. Now I'm going to have you follow my fingers in, just moving your eyes, not moving your head, and out, in, and out, in, and out. Okay. So eyes can also accommodate normally. Now, I'm going to jot that down. We're going to test one more thing. Okay, Perrla. Perrla. Little acronym. Okay. So I'm going to have you focus on my fingers here. Follow them using only your eyes without moving your head. Okay? Bring them over here, up, down, over here, up, down, and up, down, diagonally up, diagonally down, diagonally up, and diagonally down. Wonderful. So, eyes can look in all 6 cardinal directions of gaze. And that is cranial nerve 3, 4, and 6. Let's take a look at your nose, shall we? Have you been having any pain or issue with your nose? Runny nose, congestion? Okay. On inspection, the external structure looks normal. Let me grab the otoscope and have you tip your head back a bit. Okay, we're just going to look real quick. So, midline septum. And I don't see any perforation. Turbinates look okay. And the nasal passages look normal. Are you having any issues with your sinuses at all? Okay. If you wouldn't mind, I'd like to just tap around on your face to see if there's any issue with the sinuses. Okay? Just going to tap, 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 tap. Okay? Tap, 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 tap. Tap, 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 tap. Tap, 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 tap. Any pain or tenderness? No? Okay, excellent. Okay. I have a little capsule of a smell. We are going to check your first cranial nerve that governs your sense of smell. I just want you to tell me what this smells like. Okay, yep, very good. Just isopropyl alcohol. Cranial nerve 1 is intact. Nasal passages, the nose, and the sinuses are all normal. Under percussion on the sinuses, ethmoid, and maxillary. Okay. Now, let's look at your ears real quick. We're just going to do an external inspection. I just want to make sure that there's not any swelling or any obvious issues. Right off the bat. Any pain as I'm just looking at your ears? Okay, good. Right, so to test your vestibulocochlear nerve, I'm going to be rubbing my fingers, and I just want you to tell me what side you hear it on. Left, this is left for me, or right, this is right for me. Okay? Alright, so right, left, right, left, both, right, left, left, right, left, right, right, both. Excellent. Okay. So, our vestibulocochlear nerve, cranial nerve 8 is intact. Then we'll be finishing out the rest of them in just a moment. So real quick, cranial nerve number 12 governs your tongue movement. So if I could have you just stick out your tongue. Good. And move it up, down, to the side, and the other side. Okay. And can you lift your tongue to the roof of your mouth? Okay. I just want to check for central cyanosis and look at the floor of the mouth. Okay, and you can put your tongue down. I'm just gonna take a peek. Take a peek around a bit. Good. Take our tongue depressor. If you could stick your tongue out. Yep, as far as it'll go. Okay. And could you say "ah" for me? Okay, good. Uvula is normal. And throat wall looks just fine. You can put your tongue back in your mouth. Yep, I don't need that anymore. Okay. Now, I did have you take a dry swallow earlier for your thyroid. If I could have you do that again, and we're just going to check for dysphagia real quick. So if you could just take a swallow. Good. And any pain, any restriction, any difficulty with swallowing? No. Okay. So no signs of dysphagia. Cranial nerves 9 and 10 are intact, as well as cranial nerve 12. So we're going to move down to the chest here. So I'm going to just first take a look here. Okay. All right, and just seeing if there are any issues here. Okay. Would you mind turning your head to the right? Then I can look if there is any issue with the jugular venous pressure in the neck. Just hold there for a little bit. Okay. All right, and just go ahead and bring your head back. Very good. So we are going to check some pulses and just do a little deeper look at your circulation. So I'm going to feel right here the temporal pulses, and one side at a time I'm going to feel the carotid pulse. Okay, other side. Okay. Normal. Good. And I'm going to take your arm here. I'm going to feel for the radial pulse, ulnar, brachial. Okay. Other side here. We've got the radial, ulnar, brachial. I'm going to feel both sides at the same time for a radial delay. No, that's all normal. Okay. So let's move down. I'm going to just get under here. Eventually. Okay. And let's feel for the popliteal pulse. Okay, I just need to pull the leg up a bit. Okay. Other side. Good. And post-tib, dorsalis pedis on the foot, post-tib, dorsalis pedis. Okay. let's look at your hands real quick. I just want to check the capillary refill. So I'm just going to be pressing on a finger, letting the skin blanch, and coming off and seeing how fast the circulation returns. So we're just going to press, 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 press. Okay. Press, 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 press. Okay, excellent. And I'm just going to look at your toes real quick. So press, press, press. Good. Press, press. Okay. So, capillary refill is normal across the board. All pulses were normal. Capillary refill normal. Extremities. So let's go ahead and do some percussion here and some palpation. So for the palpation, I am going to be using my hand to feel for heaves and thrills. I'm going to use the heel of my hand for heaves, and I'll use the flats of my fingers for thrills. Okay. I'm just going to feel for that across the valves. Okay. And then we're going to do some percussion. So I'm going to put my hand on your chest and tap. And it'll tell me what the inside of your lungs sound like. Good. Oh, that was a little different. Okay. Okay, so for the auscultation here, I'm going to start by listening to the valves of the heart. So we're going to start on the right side for the aortic valve. And then just flip to the other side for the pulmonary valve. Come down a bit for the tricuspid. The mid-clavicular line, and down further for the mitral. Good. So, real quick, I'm just going to count 1, 2, 3, 5 mid-clavicular line that matches up right here. This is where the apex beat should be. We're just going to listen a moment. Good. So I'm going to start at the lung apices here. I'm going to have you take a deep breath in and out. We'll switch to the other side. Deep breath in and out. And move in a ladder-like configuration. I'm going to have you take a deep breath in and out. Deep breath in, out. Deep breath in, out. Deep breath in, out. Deep breath in and out. Deep breath in and out. Deep breath in and out. Deep breath in. Good. I'm just going to put this here at the side, the axilla here. Deep breath in and out. The other side, deep breath in and out. Normal lung sounds. So let's go ahead and just tuck you back in. And then we are going to listen to the abdomen here. So I'm just going to have you breathe normally. I'm just going to be listening around. Listening to digestive sounds. Listen to the renal arteries. Good. Good. Okay. Alrighty. So let's do some percussion and then we'll do our palpation. So good. Good. Excellent. And now I'm going to be doing some palpation. This might be a little uncomfortable. Okay. I'm going to start with one hand. We'll do a firm but not deep palpation. Liver. Good. Here, the kidneys here. And now I'm going to use both hands, and this is going to be a little uncomfortable. So I'm going to have you take a deep breath in and out. Just so I don't punch the air out of you. Deep breath in and out. Deep breath in and out. Okay, deep breath in and out. Okay, good. So now we're going to move on to the last part, which is testing your extremities. I'm going to start with a sensory test. I'm going to have you tell me sharp or dull. Okay? Sharp or dull. And this is what it'll feel like. So this is sharp. This is dull. Okay? So just tell me whether you feel the sharp side or the dull side. Sharp. 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 Dull. 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 Sharp. Dull. Sharp. Dull. 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 Okay. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. And dull. Okay. Now, I'm just going to take a peek at your arms and legs. So I am going to test the temperature using the back of my hand. Make sure the joints aren't overly hot, the skin isn't clammy, and then I'm going to look at the underside of the forearm, the skin, the palms. Look at the back of the hand, the fingers, Okay, so I'm going to do some passive range of movement testing. I'm going to take your hand and we're going to move the wrist up and down, side to side, internally rotating, externally rotating. Okay, and we're going to flip over and under, and then we're going to bend at the elbow. Okay. And then I'm going to take the arm and move it like this, and like this. And can we move it back? Yep, okay. That there. Look at the other one here. So, back of the forearm. Check the temperature. Look at the skin. Hands. Nails. Okay, taking the wrist, we'll go up and down, side to side, externally rotate, internally rotate, and pronation, supination, flexion and extension at the elbow. This all the way up. Okay, all the way up like that. And then all the way back. Okay. And let's just take a look at legs here. Okay. Shins, feet, up and down. Good. Side to side. Side to side. Okay, good. Now I'm going to do some strength testing with you. So if you could just hold my fingers as hard as you can with your hand. And can you pinch my fingers using only your first two fingers? Good. Okay. You put your arms like this. I'm going to try to push you. I want you to resist me. I'm going to try to pull you. I want you to resist me. Good. Okay. And I want you to bring up your shoulders. I'm going to try to push them down. I want you to resist me. Good. Can you lift your leg against my pressure here? Good. And here. Okay. Can you kick out your leg against my hand here? And here. Good. And the feet, if you could press up against my hand. And up against my hand. Good. Okay. So I'm just going to have you press your foot into my hand from below. And from below. Okay. jot down. So, we had normal heart and lung sounds. We had normal abdominal sounds, performed our percussion and palpation, non-tender, non-rigid, no guarding. And we have normal range of movement, strength. Good. And normal sensation, a sharp and dull test. Okay. That looks like we got everything. So, did you have any questions for me at all? Okay. I didn't see anything out of the ordinary. I know you had that little bit of pain, but everything in that area looked normal. So I'm going to have you just keep an eye on that, okay? All right. And do let us know if it changes at any point. But other than that, looks great. So I'm going to sign my name here. Here. And that will be that. I'd like to thank you so much for allowing me to do my head-to-toe assessment. I hope you have a whale of a day and a good rest of your night. Thank you.